Estrogen gets blamed for a lot of things. Men don't want breasts, believe me.
A big myth out there, and you hear this in, especially like the gym world, bodybuilders and so forth. There's something that's called, well, I'll just say it. They call it bitch tit.
Oh my gosh.
I don't know if you guys will edit that or not, but that's what a lot of men will hear. I don't want to get bitch tit.
Welcome to Look Good, Feel Good with Matt and Amy McKinley, the podcast where we bring you expert advice and honest, real talk on health, wellness, and feeling your absolute best. From hormone optimization to aesthetics and everything in between, we're here to help you live your best life. Let's dive in. Welcome back to Look Good and Feel Good with Matt and Amy. I'm Amy.
And I'm Matt, as you may have guessed.
So today we're talking estrogen. And is it friend or is it foe? And so when you hear the word estrogen, most people think, like weight gain, mood change, mood swings. Breast cancer is a big one we hear of when we hear estrogen. Estrogen gets blamed for a lot of things. Estrogen is actually one of the most protective hormones in your body.
Estrogen is kind of like the Kardashians. There's a lot of opinions out there on it. So what we need to do is break the myths and talk about the facts, what is true and what's not true. So Amy, let's hit the biggest one to start with, cancer.
Yeah, so breast cancer. And women are often scared to do estrogen replacement because of breast cancer. With the new research that has come out, we know that estrogen does not cause breast cancer. In fact, the studies have shown that their incidence of breast cancer goes down is if you were on estradiol or if you weren't on estradiol. It's the exact same risk, but your incidence of dying from breast cancer actually goes down if you're on estradiol.
Women on estradiol actually have a higher chance of survival if they were to get breast cancer.
Yeah.
But they do not have a higher risk of getting breast cancer. Those two things are important to understand. So if that didn't make sense, rewind this and listen to it again, because that's super important.
Yeah, there's some women out there, let's get this right, that have the BRCA positive gene.
Yeah, and that's a gene that basically will show you if you have a higher incidence of getting breast cancer from estrogen.
Yes, so those women should not be on estradiol or estrogen or anything like that because they do have a higher risk. And that usually is from family history, genetic testing we have a lot of new ways to test for that, and they can actually see if you do have that, that risk does go up, and those women should not go on estradiol because they do have a higher risk.
We always do a history and ask patients, hey, have you had breast cancer? Have your sisters had breast cancer? Has your mom had breast cancer? Because there's some wonderful screenings out there. Oftentimes they're free, or through your insurance, it may be covered 100%. So we do a good screening for that. But I'll tell you something else that is not well known. Men need estradiol as well. So it's not just a female hormone. Estradiol is a primary hormone for females. It's a secondary hormone for males. And the primary hormone for males would be?
Testosterone.
Testosterone, exactly. So for men, I'm going to explain a picture here. When men's testosterone is low, estradiol follows. So estradiol will become low, and then men do not feel good. The biggest symptom that I hear about, and I had personally, is joint pain. So low estradiol levels in men can cause joint pain. It can cause brittle bones, higher incidence of fracture, just like women. And it's also and Amy's going to go into this a little more, but protective for the brain, the heart, and the bones, the big three.
Yeah.
So it's important to understand that men, as we optimize testosterone, the estradiol levels come up with it to give us protection as well.
Yeah, and I think it's important to remember that because a lot of hormone clinics, and we're a little different than most hormone clinics, we don't suppress estradiol levels in men. We don't give them an estradiol or anything like that. We think that estradiol is important in men. And when estradiol levels go up in men, they're not going to get like weepy or sad or breast or anything like that because, they think that estradiol levels, that's what's going to happen. And no, it's very important because it protects bones, brain, heart protection. So
yeah, let me touch on the breast thing that you just mentioned.
Men don't want breasts, believe me.
Yeah, and so a big myth out there, and you hear this in, especially like the gym world, bodybuilders and so forth. There's something that's called, I'll just say it. They call it bitch tit. I don't know if you guys will edit that or not, but that's what a lot of men will hear. I don't want to get tit, and it's basically breast tissue that grows around the nipples. Bioidentical estradiol, okay, will not cause that. Men that are on synthetic hormones can get some of that, but men that are on testosterone cypionate will not get that. Testosterone cypionate, sorry.
Which is bioidentical.
Yeah, it's bioidentical. So the synthetic hormones or
like what would be considered synthetic? Like which ones are you talking about?
Anything that is not bioidentical. So like
what are they called though?
DECA is one. These are trade gym names.
And these are like illegal.
Like Winstrol. Yeah, these are all illegal. So anything that's taken illegally and is not bioidentical can cause that side effect. What we prescribe is testosterone cypionate, which is bioidentical. I have not seen that side effect in any man that I've treated.
Yeah. So we talk about estrogen is not just a female hormone. It's actually a human hormone that all of us need to have on, and so for women, low estrogen shows up, with, can see like night sweats, sometimes insomnia, anxiety, low sex drive, all of these things, but there's like
decrease in bone quality is a big one too.
That's true. And it's menopause. And really what happens is, we don't start women on estradiol until they need it, and that's usually menopause. I know back before I knew anything, I would start women on some estradiol creams because that's what I was told to do, and estrogen is good for you. And you don't start it until you need it. You don't need it. And menopause is diagnosed, or the definition of menopause is FSH, which is follicle stimulating hormone over 50, and 1 year without a period.
But oftentimes we will see the FSH being lower than that, almost always. And they're in full menopause, meaning they haven't had a period for a year, but their FSH is not over 50. I see that all the time.
Well, and there's other things that support estradiol or make estradiol. I mean, most of the time it's your ovaries producing estradiol, but there's fat cells that can produce estradiol. But the definition is FSH over 50, 1 year without a period.
Yeah, so I think what Amy's trying to get to is sometimes on labs we'll see lower levels of estradiol that are being produced from other sources besides the ovaries. Like a big one is fat cells. So sometimes obese women will have a little bit higher levels of estradiol even though they are in menopause.
Yeah. And we use the word estradiol because there's actually 3 parts of estrogens. There's E1, E2, and E3. I want to explain what E1, E2, and E3 are?
Sure. Yeah, and this is more advanced training. In fact, we had a nurse that had worked with on the OB/GYN floor in the hospital that had never even heard of this. So
what's E1?
It doesn't get educated. E1 is called esterone. Esterone is a inflammatory estrogen. So this is where it gets a little technical. So estrogen, there's different types of estrogen. E1 is esterone. It's inflammatory. That is what we don't want to give.
But what cells produce those mostly?
I don't know. Why don't you tell us?
Well, I'm just trying to ask you, but so adipose,
inflammatory,
in adipose, like adipose cells, fat cells, they produce a lot of estrone,
which is teasing each other,
which is inflammatory in nature. So we don't want a lot of estrone, and we'll talk a little bit about different ways to supplement. But so that's
E2.
E2, yeah, E2.
So E2 is estradiol. Okay, this is the one we monitor. This is the one we test for. It's the most prominent female hormone and the most important hormone. This is the one we want to give when a woman hits menopause.
Yeah.
So it protects for brain health, Alzheimer's, and dementia. In fact, I got to touch on a study that was done a few years ago, showed an 83% decreased risk of dementia and Alzheimer's when a woman was taking estradiol when she hits menopause.
So E2, yep.
E2.
So what's E3?
Well, let's talk about the other benefits.
Well, we'll get there.
Okay, we'll get there. Sorry.
What's E3?
So E3 is estriol.
Yep.
Okay, and estriol, if given, is given for symptomatic relief. It's given in a cream form.
And it's most prominent in the vaginal tissue is what it is. So dryness and things like that. Estriol is the main hormone for that. And sometimes we'll get it in cream form for dryness.
Yeah, dryness, vaginal atrophy, painful intercourse. Those are symptoms a lot of women have, and estriol can play a huge deal in that, as well as UTI protection.
Yeah.
A lot of women, when they hit menopause, hit UTIs right and left. It's because those levels are low.
Yeah. So Matt was kind of talking a little bit about the benefits of balanced estradiol. And so what are the benefits of estradiol and balancing that as we go through menopause? So we know that estradiol protects our brain, as Matt was talking about Alzheimer's. There's some good studies out there showing we have a big reduction in Alzheimer's and dementia when we're, put back on estradiol. Bones, it's a big deal as we get
Fracture
older.
risk.
Yeah, we get older. We fall, we break hips, break wrist. That should not happen if we are properly dosed on estradiol. So bones works better than some of the bisphosphonates out there. And that's kind of the new medications that have come out for bone.
In fact, it's way better. Studies will show it is way better than bisphosphonates for retention of bone mass.
Yeah.
It's the only thing that can actually build bone mass. Bisphosphonates can basically help what you have and help the decline, but estradiol can actually build bone mass. Yeah. To prevent fracture risk.
So osteoporosis and also cardiovascular disease. We talk about the biggest killer of women is heart disease, cardiovascular disease. And as we age, we lose the ability to make estradiol. And we know that estradiol is very protective of cardiovascular health. And so that's a big thing. And actually, kind of as we get a little deep dive into different types of ways to give estradiol, because there's a ton of ways to give these medications, these hormones. We can do it in transdermal creams. We can do it in patches. We can do it in injections. We can do oral injections. There's a lot of different ways to give these hormones. But the way you give these hormones, the body processes it different.
Can I tell them this is a fun part? Can I?
Go ahead, honey. Go ahead.
So the best way to give estradiol is orally.
And people will disagree with us. Different hormone clinics will disagree. I was a cream girl all day long before I knew the studies that backed up why oral is better than cream. So
So oral, although Amy, we mentioned creams, they're not bad. So if you're taking an estradiol cream right now, it's okay. But orally, you get the biggest difference is your cardiovascular protection. So you will get that, which you will not get from a cream.
Well, creams show that they keep plaques stable. That's really what it comes down to.
And plaques, she's talking about plaques that attach to arteries or heart disease, cardiovascular
so
disease.
It keeps it stable. But we have shown, there's studies out there, and there are really good studies that show that actual oral estradiol taken orally actually reverses plaque in the arteries. So if you had the choice of something reversing plaque versus keeping plaque stable, what would you do? I mean, it doesn't make sense. It makes sense to take oral versus, and it's something to do with the liver and the conversion of HDLs, increasing HDLs, and that, because HDLs we know is good.
HDLs are the good cholesterol that actually clean your arteries. So we want to elevate those levels and decrease the LDLs.
Yes. So that's why estradiol is so important.
The oral estradiol, yeah. So it gives you all the protections, not just a couple of them. That's why we prescribe oral estradiol. Also, very important, this is a myth, that there's a higher incidence of oral estradiol and blood clots versus creams. Not true.
And that's one where we'll kind of get a little backlash on, and that's okay. If it was my mom or my sister or somebody or yourself, I would definitely do oral estradiol all day long. However, there's still that stigma out there that creams bypass the liver and don't, have a lower risk of stroke. Or
the only time we would give a cream really of estradiol is when a patient does have a history of blood clots.
Even
reason
if I had a history,
is
I would
because
still do it.
Yeah, we could get sued if the patient had another stroke.
Yeah, so we still practice kind of that cover your butt medicine because it's real, and but at the same time, if I've had a stroke from something, from a surgery or whatever, and I knew the benefits of oral estradiol, which I do know, I would take oral estradiol all day long.
Yes.
So
anyway. The takeaway from this whole thing is don't fear estradiol. And you've noticed through this podcast, we started out talking about estrogen, and we've really focused on estradiol, which is E2, the bioidentical hormone that's protective. So remember that. That's important. Write that down. Put it in your brain. That's what you need to have is estradiol. Don't fear it because it is going to help you live a longer life.
Yeah, and I tell people all the time, I mean, I talk about the differences, and I'm going to kind of make the difference between there's estrogens, and I kind of refer those two as synthetic, and estradiol, which is bioidentical. So estrogens, which I refer to as the pharmaceutical industry actually can't take your hormones and brand it and make money off it. So they've had to come up with something different. And they found that there's horses that were pregnant, they actually had estradiol in their urine. And they actually took that and branded it as Premarin. So Premarin stands for pregnant mare's urine. There's a little bit of estradiol, but most of it's inflammatory estrogen or estrone, and it doesn't look exactly like our estradiol. It doesn't look like ours. And so it's synthetic, where we actually have bioidentical estradiol, which we know how to make. So when I say that, if you were looking under a microscope, a chemist couldn't tell the difference between estradiol, your estradiol, and the estradiol I'm giving you. So your body can't tell the difference either. So I'm just saying there's a difference between the two.
Yeah, and that's more advanced training, and this is what most practitioners don't understand, and it takes a deep dive and learning and looking at studies to understand this. And this is where we pride ourselves. We've gone the extra mile to make sure we really understand it.
And so it's just important to remember that. And in some of the older studies out there, the WHI studies were done on synthetic estrogens, Premarin, and synthetic progesterone. We'll get a little bit more into progesterone in future topics, but just knowing that there is a difference. And so we thank you for joining us today to our podcast. And anyways, hope you enjoyed it.